Very good evening, students. Now this is the first video lecture on the thorax. So after completing the lectures on the upper limb and lower limb, now we are on the thorax. Now today is the lecture on thoracic wall, from which I have selected a very important question, and it may be a long question but I have split it into the different part. An individual part can be also a short note. Now the long question may be like this: describe a typical intercostal space under following heads. This may be a long question. Okay, introduction, I will just describe about the thoracic wall, and about this question I will give you a little introduction. Then we will learn about the intercostal muscles. As I said, there may be a short note on the intercostal muscles itself. Then intercostal nerve, there may be a complete short note or a short question even on the intercostal nerve. And then the intercostal artery. And lastly, I will come to tell you about the applied importance in relation to nerve and in relation to the intercostal artery. Now, let us come to the introduction of the intercostal space. Okay, so we are now on the chest wall or thoracic wall, and we are learning about the introduction of the intercostal space. What is an intercostal space? The intercostal space is the space between adjacent ribs and their costal cartilages. Okay, in this diagram I have tried to show the manubrium sterni, body of sternum, and GP sternum. And then here you can see the first rib, just I will write down as first, second, third, fourth, fifth, sixth, seventh, eighth, ninth, and 10. So I have written the numbers on their costal cartilage, and you can trace their rib itself. Okay, so it is a space. What is intercostal space? It is a space between the adjacent ribs and their costal cartilage. This is space. So I will just number the spaces here between first and second. This is the first space, second space, third space. Okay, this will be the fourth, fifth, sixth, seventh. Okay, just a minute, something has. This is the seventh, sixth space, and this will be the seventh space. Okay, the eighth, and this is the ninth space. Okay, so where I have written the number in circle, they are the intercostal space. So in the first 10 ribs, there will be the 9 intercostal space. Total there are 11 intercostal space. Okay, between the 12 ribs. Okay, 12 ribs on each side, on right side as well as on the left side. There are the 11 intercostal space, because below the 12th rib there is no intercostal space. It is called as the subcostal space. Okay, now as I said that this only encloses the 11 intercostal spaces, okay, between the 12 ribs and their intercostal cartilage, between ribs and costal cartilage. Now let us come to see that these intercostal spaces are divided into two categories, or two types of the intercostal. Number A here is a typical intercostal space. You keep on noting in your notebook. Okay, the first type of the intercostal are the typical intercostal space, and they lie between third to the sixth intercostal space. They are considered as the typical intercostal space. And why they are classified as typical intercostal spaces, third to sixth? That means the third, fourth, fifth, sixth. Okay, these 4 spaces. Okay, third, fourth, fifth, and sixth, they are classified as the typical intercostal space, because their nerves and blood vessels are confined within the thorax. That is the intercostal nerve and intercostal vessels which are present in these intercostal spaces from third to sixth. They are within the intercostal space or within the thorax. They don't go outside the intercostal space, in the same intercostal space. That's why third to sixth are considered as typical intercostal space. Then there are atypical intercostal space, and the space number 1 here and space number 2, they are considered as atypical intercostal space. Similarly, the space between 7th to 11th, that means this space 7th, which lies between 7th and 8th ribs and costal cartilages, between 8th and 9th, that is 8th intercostal space, and then the 9th intercostal space. So first and second, 7th, 8th and 9th, okay, and then extending to that of the 10th and 11th, okay. All these are, so first, second, 7 to 11, they are all intercostal spaces, okay. They are all called as the intercostal spaces, which are atypical intercostal space. Now let us see why they are called as atypical intercostal. As per our definition, typical means where it's contained, that is the intercostal nerves and vessels are confined within the thoracic wall. They don't go outside the intercostal spaces individual. But in case of the first intercostal space, the first nerve, that is the first ventral ramus of the first thoracic nerve, which lies in first intercostal space, gives a main contribution in formation of the brachial plexus. It forms the lower tongue by uniting with that of the cervical 8th spinal nerve. So this is not confined within the thorax, okay, thoracic wall. It forms the brachial plexus which supply the upper limb. Then the second intercostal nerve, okay, that is also not there, okay, within the intercostal space, second intercostal space, because it gives a branch which goes into the axilla and on medial aspect of the arm, where it joins with the medial cutaneous nerve of arm, and this branch which joins the medial cutaneous nerve of arm is called as intercostobrachial nerve, and thus this is also not confined or limiting itself within the second intercostal space. Now this nerve is a cutaneous nerve which goes to the floor of the axilla and to the medial aspect of the arm, okay. And this is the nerve responsible for the pain during the myocardial ischemia, or in layman terms, heart attack. During the heart attack, there is a pain in the medial aspect of the arm. Okay, this is because of this nerve, okay, intercostobrachial nerve. Let us come to the 7 to the 11. The nerves 7 to the 11, they are also not present within their intercostal. Their main contribution after the supplying to the intercostal space, okay, it goes into the abdomen. So they are thoraco-abdominal nerves. So from 7th to 11th nerve, they go into the abdominal wall, okay. So they are not also classified as a typical intercostal nerve. So this is the reason why the space first, second and 7 to 11th, they are called as atypical intercostal space, okay, atypical intercostal space. Let us come to the other aspect of the intercostal space, okay, which is a space between the adjacent rib and their costal cartilages, okay. So see the extent. The extent of the intercostal space is from it extends posteriorly up to the costotransverse ligament. Okay, I have drawn a diagram here and will show you the extent of an individual intercostal space. This is the first costal cartilage, so I am drawing it just to differentiate it from the rib, as we will use it later on, okay, in relation to the artery. So these are the costal cartilages which I am drawing with that of the blue color, right? So these were the costal cartilages. So this extent of the typical, we are talking only of typical now, okay, of a typical intercostal space, okay, because our question is a typical intercostal space. So the extent posteriorly is up to the costo-transverse ligament. Okay, what is the costo? It is the superior costo-transverse ligament which extend from the rib. This is the rib and this is the transverse process. And since we are looking the vertebral column from posterior aspect, okay, this is the neck of the rib and head must be articulating deep with that of the vertebral bodies. Okay, this is the upper border of the rib. From this upper superior border of the rib, there extend a ligament what is called as the superior costo-transverse ligament, which I had drawn with the green color, okay, superior. There is another ligament here which extend from the tip of the transverse process to that of the non-articular part. Their articular part is forming a joint here, okay, with the tip of the transverse process, but non-articular part of the tubercle of the transverse process, okay. So this is non-articular process which will give attachment to the ligament extending between the non-articular part of the tubercle of the rib to that of the transverse process, and this is called as the lateral costo-transverse ligament. Okay, we are not concerned here with the lateral costo, just it was there for orientation purpose I have defined. So this space, okay, this space here is that of the intercostal space between this upper rib and this is the lower rib. In between these two ribs, this space extending posteriorly up to the costo-transverse ligament, okay, this extend up to the costo, and anteriorly this space extend up to the lateral margin of the sternum. See here, have you seen this lateral margin of the sternum? So this space extend up to the lateral margin of sternum. So it forms a circle, okay, semicircular shape. So it goes from posterior to the anterior side. See this space, okay, from the here from, say for example, tip of the transverse process, this space will start and will go right up to the lateral margin of the sternum. This is the sternum, body of the sternum, so in transverse section, and this is the transverse process, TP. TP here means transverse process. This is the body of the vertebra, and then from here in this way, this is the space which is extending postero-anteriorly, okay, the space is acting postero-anteriorly, right. Let us see now the contents of an intercostal space. The contents of the so we have learned the extent, both anterior extent and that of the posterior extent, okay, anterior and posterior. Let us see the contents. Contents of this are a typical intercostal nerve. So typical intercostal nerve, okay, I have written inside, you please write, okay, full name, typical intercostal nerve, okay, and we will just learn what is a typical intercostal nerve is there, okay, and then intercostal muscles. So this will be the muscle. Intercostal muscles are also contained within the two adjacent ribar costal cartilages. There are the intercostal muscles are present here, okay. So there are the third content will be the intercostal vessels, that is intercostal artery and intercostal nerve. So artery and the intercostal vein. So these three are the contents, that is intercostal nerve, intercostal muscle, and the vessels. Okay, they are the contents of this. Complete even a short note on to the intercostal, typical intercostal space. You have to define what is an intercostal space is that, and how it is classified into typical and atypical intercostal space, and then you have to tell about the extent of the intercostal space anteriorly and posteriorly. Then you have to tell about the contents of the intercostal space. Okay, intercostal, that is artery, nerves, muscles. Okay, now we come to the second aspect of this question, and which was the second aspect? It was the intercostal muscle. So we have completed the introduction or the intercostal space itself and the intercostal muscle. Now in the intercostal muscles, they are the thin muscles present between the intercostal space. Okay, so let us go to the details of this muscle. Okay, now these intercostal muscles are present in intercostal spaces, that means between adjacent rib and costal cartilages. Between adjacent ribs here, between adjacent rib, and also between the adjacent costal cartilages. This space between the ribs and the costal cartilages are occupied by the muscles. Okay, they are occupied. Let me draw these ribs also with the color, the black color pencil I will use to draw these ribs, so that you don't get difference. I mean, say you can clearly distinguish between the space and between the ribs. Okay, this is not possible just now. Okay, so I am just drawing the inner aspect of the rib just to differentiate the rib and the intercostal space. Okay, hope now they are clear. Okay, hope they are clear. So this is also the rib here. Okay, this is the rib, this is the second rib, and this is the posterior aspect of the two adjacent ribs and intervening intercostal space. Okay, so let us come to the muscles. Okay, now these muscles, from superficial to the deep direction, they are three different muscles. Okay, they are three. That means they are arranged in three layers, and they are known as external intercostal. Please note down your notebooks. Okay, external intercostal, internal intercostal, and innermost intercostal, which is also sometimes called as intercostal. Intercostalis intimus. Intercostalis intimus. Okay, if you don't want to remember this name, innermost intercostal is a good name. Okay, so external intercostal, internal intercostal, and innermost intercostal. These are the three muscles which are arranged between the two adjacent ribs and costal cartilage are in the intercostal space. Okay, intercostal space, all 11 intercostal space, all these muscles, three muscles are present. Let us come to see very quickly about the origin and insertion of these muscles. Okay, let us come first to the external intercostal muscle. Okay, external now this muscle extend posteriorly, as I said, from tubercle of the art up to the tubercle of the rib. I mean to say, it extend up to the costo-transverse ligament or up to the tubercle. I said that there is a non-articular part of the tubercle. So from tubercle, okay, and anteriorly up to the junction between the costal cartilage and the ribs. Okay, this is which muscle? We are just now talking about the external intercostal. So it extent is from the tubercle of this rib, okay, or from the ligament, that is costo-transverse, lateral margin of costo-transverse ligament, and they go right up to the costochondral junction. What do you mean by costochondral junction? A junction between the rib, anterior end of the rib, and the costal cartilages. Okay, so this is the extent. Okay, because anterior to the costochondral junction, okay, this muscle is replaced by an anterior intercostal membrane, and membrane I will draw with the green color. So beyond this costochondral junction, this muscle is replaced by the membrane. So between the costochondral, between the adjacent costal cartilages up to the lateral margin of the rib, there is a presence of the membrane called as the anterior intercostal membrane. So I will just write down anterior intercostal membrane, because there is a posterior also. This is called as anterior. This is called as anterior intercostal membrane. Okay, if you are not seeing properly, little zoom that area. Okay, so anterior intercostal membrane. In the rest of the area, this is occupied by the muscle, and just I will draw this muscle like this. Okay, and let me tell you first its origin. It arises from the lower border of the upper rib. Okay, lower border of the upper rib, and in this cross section I have just drawn the two adjacent intercostal spaces. Okay, this is the outer surface and this is the inner surface, and this dotted line indicates the parietal pleura. Okay, that is the inside, it is inside. So this muscle arises from the lower border of the, this is the lower border of the upper rib. Okay, this is the lower border of this rib. So from this muscle, this arises from the lower border of the upper rib and is inserted into the upper border of the lower rib. So in the second space I can also draw like this, from the lower border to the upper border of the lower rib. Okay, now regarding the direction of its fibers, the direction of these fibers, okay, they are running in a particular direction. Okay, these are directed downwards and forwards. Okay, forwards. Let us see the downwards and forward direction. I will just show you in one of the space. Okay, so you can just see this. Downwards and forward is up to the anterior intercostal membrane. So this is how the fibers are running from upper rib to that of the lower rib, and then at the costochondral junction it becomes continuous with that of the intercostal membrane, anterior intercostal. So the fibers are directed downwards, forwards, and laterally. They are directed anteriorly, forwards and anteriorly. That means forwards means anteriorly, downwards, forwards, and medially. Okay, medially they are directed downwards, forwards, and medially. Anteriorly, I mean to say medially, it was going to the medially. But if you will see this muscle on the posterior aspect, okay, posterior, what will be the direction? The direction is forwards, downwards, and laterally, because this is the median plane here. Median plane on the posterior aspect, you will see that they are going directing downwards, forwards, and laterally. Here they are going medially, but here they are. Why it is so? Because they are forming a circle. That means the direction here will be laterally. Okay, I am now drawing the muscle throughout its thickness, and then as it will come towards the anterior aspect of the chest wall, the fibers will start going downwards, forwards, and medially. Here we are going downwards, forwards, and laterally. Okay, but here, so this is the muscle in its whole extent, right from that of the transverse process level, from ligament or tubercle. This goes right up to the costochondral junction, and after that this muscle is arranged in the form of a membrane, which we already learned, which is called anterior interosseous membrane. This completes the external intercostal muscle. Let us come to the internal intercostal, that is second muscle, which is present deep to it. Now this muscle extends from sternum to the angle of the rib, and beyond this angle of the rib it will be replaced by the posterior intercostal membrane. Let me draw it first. Okay, see here in this diagram I draw the extent. It is starting from the lateral margin of the sternum, and then it is going up to the angle of the rib. And you read the osteology of the thorax and you know what is the angle from where the muscle, the rib changes its direction. So this is the muscle going up to the angle of the rib. Okay, it is going up to the angle of the rib, right? So this is how the internal intercostal is arranged. Okay, it's extend. So it is muscular right up to the lateral margin of the sternum. Okay, let us see the its origin. This muscle arises from the groove, floor of the costal groove. See, this is the costal groove is there present in every rib near its inferior border. Okay, this is that called as the costal groove. So this is that in this space also I am drawing. So from this costal groove of the upper rib, and then it goes up to the lower rib. So from costal groove of the upper rib going up to that of the lower rib in the intercostal space. Okay, so this is the internal intercostal. Let us see the direction of its fibers. Okay, we will see the direction of its fiber. The direction of its fibers, it is directed downward, backward and laterally in front of the thorax. Okay, directed downwards, backwards and laterally. Now I will draw this in this space, this muscle. Okay, so this is deep to the anterior intercostal membrane, and suppose there is no anterior intercostal, we have removed the anterior intercostal. So now from the lateral margin of the sternum the fibers are directed downwards, they are backwards and laterally. See, these are directed downwards, backwards and laterally, and will go right up to the angle of the rib. Okay, from lateral margin of the sternum to the angle of the rib. Okay, now since angle of the rib is not here, I will just extend this. Okay, I think I should do it like this. This muscle is directed here. In case of the posteriorly, it is going here. The direction here is just opposite. Okay, so it is deep to here was right up to this was the your external, and then this is the direction of the internal. Okay, so we are seeing deeper. Okay, I will extend this rib so that you can get an idea. Okay, I am extending this rib. Okay, and we have just cut the external here from where I am drawing, and we are seeing the deeper part. Okay, so this is that direction. Here it is directed downwards and backwards, downwards and backward. Here it is and laterally. Here it is directed downwards and medially. It is directed, this is the internal intercostal, downwards and medially. Just note down this important fact. Now then comes to the third muscle of this, and that is the innermost intercostally, costal, innermost or intercostalis intimus, or when plural it will be called as intimi. Okay, so let us see the third muscle. Now this third muscle takes its origin, okay, again from the upper rib, okay, upper rib, and goes down, okay, to the upper superior border, inner margin of the superior border of the lower rib. So origin is from the upper rib and goes down to that of the lower rib. But then this muscle is present in only the lateral 2/4. That means it is in the middle part. Okay, this muscle is present. That's why this muscle will look like this. It is present only in the middle part of the intercostal space. Okay, 1/4 it will be not going posteriorly and 1/4 it is not going anteriorly, but in the middle 2/4, okay, this muscle is present. Okay, so this muscle is called as innermost intercostal muscle, again taking origin, okay, from the upper rib, then going to the lower rib, and this is from the upper margin of the costal groove to that of the superior surface of the lower rib. Okay, superior surface of that. Now the direction of this muscle is same as it was that of the intercostal. Okay, the inner intercostal or internal intercostal. This internal intercostal and the direction of the intercostalis intimus or innermost intercostal, they are the same. Okay, that means this is also directed downwards, backwards. Okay, directed downwards and backward. Okay, so this muscle is directed, sorry, this is anterior aspect, so I should draw it downwards and backwards. Okay, this is downwards and backwards. Yes, it is correct here, downwards and backwards it is going. Okay, this was the downwards and forwards and medially. This is downwards, backwards and laterally it is going, laterally, right? So it is in the lateral direction. So these are the direction of the three muscles, that means innermost intercostal and internal intercostal. They will have the same direction. They will have the same direction. Downwards, okay, the downwards, backwards and laterally. Downwards, backwards and laterally. Right. But then this is not going. The innermost intercostal, I forgot to mention that this is extending only up to the angle, only up to the angle, and beyond that it is extending up to the rib, I mean say transverse process, as an membrane. This membrane here I should draw it into the green color. This membrane is called as the posterior intercostal membrane. So this is the posterior intercostal membrane, and this is the continuation of the internal intercostal muscle, the continuation of the posterior intercostal muscle. Now these are the intercostal muscles. Okay, they are extend and how they are replaced anteriorly and posteriorly by the membrane, that is anterior intercostal membrane and the posterior intercostal membrane. Okay, let us come to see another aspect here, that these muscles are sometimes called as the innermost intercostalis muscle is sometimes said to be a part of the transverse thoracis. Okay, a muscle is called as innermost intercostal is called as the transversus thoracic, which has three components, that is sternocostalis. From sternum muscle arises and goes to the costal cartilages, and innermost intercostal or intercostal intimus we have already learned. And then the third component is that of subcostalis, that is on posterior aspect. Then this sternocostalis and subcostalis, I don't consider that they are the part of the intercostal muscles. Why? Because these muscles, they are not confined within an intercostal space. For example, sternocostalis takes its origin from the posterior aspect. Just imagine that this is the posterior aspect of the sternum, so it will take origin from the posterior aspect sternum, Giffard process and costal cartilage of the 4th, 5th and the 6th rib, and then this muscle will send the slips upward from 2nd to that of the 6th costal cartilage. Okay, so this is crossing the various intercostal space, that is called as the sternocostalis. Hence it cannot be said to be as the intercostal muscle. Similarly, the transverse muscle, okay, this subcostalis, not transverse, the subcostalis muscle, it takes origin from in the lower intercostal segment from the rib itself, inner aspect of the rib at near angle, and then it goes downward, okay, to the lower, crossing 2 or 3 spaces, and then they join to the lower ribs. So this is also crossing the many intercostal spaces. So if there is a question on the intercostal muscle, better to write also about, say better to write only 3 muscle: external intercostal, internal intercostal, and the this innermost intercostal, okay, innermost intercostal, right? So this completes our this part of the question, and which was the C, intercostal muscles, okay. Now we come to the C, that is the intercostal nerve. So I will explain you about the intercostal nerves.